Thanks very much. That was a really great session right before talking about sleep. I'm Dana Roop, our research director with Frost & Sullivan, and what we found in some research with U.S. consumers is that about 1/5 of U.S. consumers have done a couple important things in the last couple of years to improve their health. One, changed their habits to get better sleep, and two, started tracking their healthcare-related information. Both of those two components together, I think, present a really great picture of opportunity for sleep focus and sleep technology. When we've looked at different facets of the healthcare consumer segments from a persona standpoint, this is what we have recently found in a piece that we did called The Consumer Culture of Health. Whether it relates to the healthcare skeptic, the budget-constrained consumer, the self-motivated suburbanite, the afflicted urban professional, there are many different ways that and personas of consumers out there and how they're trying to experience their health and healthcare. But I'm going to focus on one of these in the context of sleep, and that's the afflicted urban professional. The reason for this is about half of them cite sleep as a top area of where they're working on to improve their health. And so who is this type of consumer? They're a male in their late 30s to early 40s living in an urban environment that has a good mix of mobile device exposure and use, extending into wearable or other devices. They're using healthcare applications. They're actively trying to monitor their health. But the one key component here is they self-identify as having 3 or more chronic disease conditions of some kind. Whether it relates to heart disease, diabetes, mental health, and depression concerns, this is the type of person who is trying to do something to improve their health because of that consideration. So when it comes to sleep, what are a couple of things that are of great importance? One, the user experience, and two, the data streams. So if somebody's trying to leverage some component of technology, like we just saw in the prior session, they definitely don't want to be experiencing something like this in their daily sleep experience. It definitely needs to be non-invasive and non-contact, in my mind, in that optimal path for what that person is trying to experience every night. Two, a wearable is not the optimal path for data, of course, with your sleep. And there are varieties of reasons for that, like there can be charge cycle concerns with a smartwatch. I, for example, have burned through I don't know how many wearables in the last few years, and if that's my only data stream for me, if somebody who's interested in their sleep, you basically lose that opportunity from a data standpoint in trying to improve that part of your health. So in digital health, where have we been continuing to progress? We have surpassed that point where sleep is a common expected data point for users as part of what they're looking to in terms of devices or other applications as part of things they're trying to understand in their healthcare. And we're now moving into what is more of a common user expectation, which is in reality leveraging multiple sensors, applications, or devices fully interoperable as a platform. So this definitely plays an important role in terms of what we see in the sleep tech ecosystem, which is really about building a wide range of personalized devices, applications, and other factors that are part of an ecosystem around you and how you're trying to understand your sleep and your data. So it can be worn devices. Even here, I have an oral appliance where I'm sure somewhere at CES in the expo, at a booth, there's probably an oral appliance where somebody's trying to tie in a mobile application to it. But mobile applications here also play a critical role. It can be a mix of different things, those tied to devices, those that are freestanding, those that are a part of a central component of an mHealth platform, such as Apple's Health. But one of the most important things here in regards to sleep tech is it's really a great place to see that intersection between digital healthcare and connected home. There probably are not many areas, but really I think it's central to the component of sleep and sleep technology because of the fact that you definitely want to have non-invasive aspects of data capture for your sleep data such as, for example, what we just saw, or this device I have up here at the top from EarlySense from a sensor technology standpoint. And it definitely, all sorts of other aspects of connected home, whether it relates to smart lighting, smart temperature, all of these things increasingly, of course, will work together, hopefully seamlessly as a platform from your user experience. And if you're lucky enough for your employer to have invested in one, perhaps you can also experience a sleep pod, although I'm still waiting for that at Frost & Sullivan. So this slide shows a clinical-oriented segmentation of the market, and here tied to worn devices, which we extended into more medical or clinical grade ones from a use case standpoint. When you look at diagnosed sleep disorders alone, what do you find? You find that it has about a $5 billion market opportunity in the next few years through the end of the decade for these types of devices. And the more important thing here is this view, which is that extended market view. Because of the number of conditions, concerns, diseases, et cetera, that you can play an impact from a positive standpoint if you're looking at, let's say you have a diagnosed sleep disorder, or if you're somebody that's just interested in sleep, to make a positive impact overall in your healthcare. So again, for sleep tech, it's about both that core opportunity and the extended market opportunity as well. So healthcare moving forward. Digital healthcare is about a lot of different factors: the Internet of Things, the Internet of Medical Things, the continuum of care, value-based healthcare, population health management, patient engagement, more coordinated care. And if you look at all these types of factors together, it really showcases the key opportunity for digital health to, of course, play a transformative role in healthcare moving forward. And in the context of this type of future view, what are some key components for sleep and sleep tech? Relates to, I think, awareness, engagement, big data analytics, the platform environment, and artificial intelligence. So awareness here is not just about the importance of focus on sleep, but it's about the diverse range, like I showed from that ecosystem picture, of technology and application solutions that you can look to help understand and solve or be used as part of your sleep technology experience. Engagement is about patient engagement, but also here I think important about user engagement from a stickiness standpoint in creating solutions that help retain your user over time with what they're dealing with. And that ties into the platform environment. Flexibility here is something which definitely is of key importance because of the fact that you see devices and applications continue to churn in and out of the market, but also users can be pretty fickle in what they're dealing with as they build their platforms also. So people's desires change, their preferences change. So maintaining that flexibility for a platform environment here is, I think, very important. And that's also one of the most important things as well in overall digital health. With all those devices in the platform, you definitely need to use that data in some way from an analytics standpoint, but extending that data utilization into more big data concepts or use in concepts like population health management will be an important part of the conversation from sleep technology as we continue to progress forward. You have a lot of stakeholders with your healthcare. You have, of course, yourself, providers, payers, employers, other loved ones, and probably one of the most important new partners in your healthcare as we progress further into the future is probably your chosen artificial intelligence partner. And this is for many reasons, but because of that broad aspect, especially here, of the convergence components between digital health and connected home, your AI partner, I think, will play a really important role as a new stakeholder in working with you wherever you are, or especially in your home, to understand your sleep, your optimized home environment, and your optimized healthcare overall moving forward. Thanks very much.